Hi, this is Dr. Fowler with some Chiro talk here. This week we had a lot of questions about actually the Webster technique. We see a lot of mommies, we call them prego mamas here in the clinic. Back when Dr. Barb was working here, that was her specialty with kids and pediatrics, and I've been thankfully able to take it over the past 8 years as she's been out of the office. We have a lot of moms under care. A lot of moms are referred in by other patients or our current patients to get pregnant, and it's very rewarding that our local midwives and OBs sent to us. Most moms find that after getting adjusted or while getting adjusted, the result is having a much better and easier pregnancy, less aches, pains, hip pain, and issues while they're pregnant. Also pubic symphysis pain, which is a big deal. There's some very great ways to help with that. Also, an easier birth. As you can imagine, if there's old accidents, injuries, repetitive stresses, ways that we're shifting and moving, it actually will help. Here's a spine. Shift the hips, and these areas can be stuck and not moving the right way. And the sacrum can get stuck and move the wrong way. As I mentioned, this can also pull in that front area right here, causing the pubic pain. But that being the case, that does not allow the baby to have as much good motion. It can cause hip pain for the mama, or upper thoracic pain, and sciatic issues. So these are very, very common things to work with pregnancy, and it's super rewarding to help our mamas feel better. Normally, if a mommy comes in through her pregnancy, we normally see them about every 2 weeks. If someone comes in with pain, we can normally get them out of that pain for the first week or two, and then from there just maintain. A couple quick things. One, Webster technique comes up a lot. So we're going to talk about the Webster technique and show you here. So one, this is one of our tables that works really well for pregnancy. I'm going to kneel down here for a second. What actually happens is this table goes all the way down. This one, which is real nice, comes up. So like right now I've got one mom that is 32 weeks pregnant with twins. She's got a big belly, as you can imagine, but she's able to sit comfortably. We've got a couple different pillows. One is more shallow. This one's quite deep, so a mom can actually lay down on the table very comfortably, belly here, chest here, and just lay and relax. Most moms want to actually rent the table because it feels so good, and it's the first time in a long time they've been able to lay down. We're able to gently use what are called blocks. So if your hips are really rotated, grab these real quick. We have some very, very easy ways that you can actually put the blocks under through here. Just laying on there and doing some stretching with that will turn and rotate the hips the right way. We have drops on the tables, which is a very comfortable way to get adjusted. Instruments, and then also the side posture. Webster technique itself is a technique that is made to decrease what's called in utero constraint. They used to call it turning the baby. You cannot say that anymore. It's called decreasing utero constraint. Primarily what that means, and I'm almost done with the video here, I know I'm talking longer, is if your hips are, say, shifted to one side, on the opposite side, the muscles are going to be tighter to compensate for that, and it's not going to allow the belly to move like it should. Most mommies that are having this issue will notice called the bowling ball belly, where you can put your fingers in and your fingers bounce off. Once you get adjusted and get things balanced, normally you can sink your fingers in just like normal, and it's much more comfortable. As you release the back area, focusing on the sacrum, the triangle bone in the center first, there's a technique with the sacrotuberous ligament, which you do some gentle stretching on. And then when you turn over, there's some gentle stretching on the front of the leg and in the groin area. Doing those things properly will release the back and the front on the opposite sides. And it's like if you take a parachute and you pull down on the strings, it makes more room up top, more air, and it slows things down. Same thing here. If you release everything on the back, it opens up and releases the belly. And we see a lot of babies move into the right position and just much more freer, more movement, and much more comfortable for mama. So I'm going to come back up here for a second, Matt. Thank you so much. This has been our pregnancy little tips and tricks here. We love to see our mommies. If you have any questions, please go to our Chiropractor Rowlett and check things out. Go to our Facebook page. We're here to help. And here's to your success and health. Have a great day.